Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $90. Bar members get 10% off. The Barbados Diabetic Eye Screening Program.
Is that Santa Claus passing in his sleigh?
No, it's not Santa Claus. That's because it's time for a special Christmas edition of the Maria Holder Diabetes Radio Show. Heard every Saturday morning at 9 on VOB 92.9 FM. 15 sugar-free Christmas minutes with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Centre. Good December morning to Larry Mears and all the good people who are tuned in to VOB 92.9 FM. If you listening to VOB right now, I mean you. It's Peter. Don't mistake me for Santa Claus, boys. And on behalf of the Diabetes Foundation, I am here to remind you that just because it's Christmas does not mean that you can go and just eat down the place like you name clear the course. Especially if you like ham. In this show, we are going to have a special message for you ham lovers. You like ham? You like ham bad? If you are one of those people that this could be your personal theme song.
Bring out the ham, it's time to yam.
If that is you, and you like eating ham, you might be wondering,
Is ham good or bad for diabetics?
Dietitian with the Diabetes Foundation, Miss Victoria Cox, will be answering that question inside of this show.
So let's talk ham.
That was Victoria there, and we will be talking ham later, so make sure and keep listening. But in the meantime, let me remind you that the Maria Holder Diabetes Centre, located in Warren St. Michael up there by Price Smart, behind Morris Gibson Polyclinic, where the minivans to stop, they continue to look after the needs of both diabetics and pre-diabetics. They have psychologists, nutritionists, specialist nurses, and diabetes specialist doctors. The center also houses a foot care clinic, which is run by pediatric specialists who work in tandem with the rest of the team. Other services offered by the center are exercise therapy, diabetic eye screening, and on-site point-of-care laboratory services. Patient empowerment and self-management are the central focus of every encounter. So in other words, they encourage you to look after yourself and gives you the information that allows you to do exactly that. And that is why they had an open house recently where UK Diabetes Ambassador Mr. Tony Kelly gave an informative talk on diabetes. Let me listen to what Tony had to say.
The former Prime Minister of Britain, Theresa May, has type 1 diabetes. Two other people I mentioned is the well-known black American actress Halle Berry has type 1 diabetes. And the fourth person I'll mention is a rower, an Olympic rower in Britain named Sir Stephen Redgrave. He won 5 Olympic medals on the trot at the Olympic Games. He has type 1 diabetes. So that you're crystal clear in your mind, we have an organ situated from here going this way, 6 inches in length, called the pancreas. The pancreas makes the hormone insulin. This is where it is situated, 6 inches in length. Without insulin, you will die. You can live without any eyes, any teeth, without any hair on your head. You cannot survive without insulin. So we give thanks and praise to Sir Frederick Banting. 101 years ago, in Canada, I was there 4 years ago, he noticed a meager dog outside, Sir Frederick Banting. He was a doctor. And he, along with his student Charles Best, made this concoction, artificial or man-made, and it was man-made, it wasn't woman-made, I'm afraid. So artificial, man-made, they made this concoction, they injected it into the dog 101 years ago, insulin, and noticed the dog was synthetic, making a recovery. That was how insulin was discovered. So if you're going on any of these quiz shows in Barbados, you'll be able to get that as your answer. Now, having said that, with type 1, the pancreas, suddenly stops working at a very, very quick, no tired, no toilet, just everything packs in all in one go. Tired, toilet, thirsty, thinner, blurred vision, and slow healing of cuts and wounds. That is type 1. Only 8% of people have type 1. They therefore have to inject, either with a pen or with a syringe, insulin into their stomach area up to 3 times a day. Some prefer not to do that. Even children can have type 1. Okay? Some prefer not to do that. So they wear an insulin pump strapped to their body, and it drips the insulin. And when I do this, just slowly but surely, when I do this in schools and colleges, the children ask, so can the person go have a shower or a bath? Yes, they can take the pump off, go and have a shower or a bath, but they have to put it back on because that keeps them alive. That's type 1. 90% of people, as I said, with diabetes have type 2, which is either, as the video just said, the insulin is either not, the pancreas isn't making enough insulin, or what it is doing, it is not doing its job properly. Now, some people, as I said, no known cure for diabetes, remember that, but some people lead such a good life that the diabetes goes, just like how cancer can go into remission, the diabetes can go into remission.
Thank you, Mr. Tony Kelly. You hear that? That is what the Diabetic Centre would like to do for you. Work with you so your diabetes goes into remission. Encouraging you to take care of yourself. And speaking of that, you had your eyes checked for diabetic retinopathy yet? This year almost coming to an end and a new year soon beginning. And once you're a diabetic, you are supposed to get your eyes screened for diabetic retinopathy every year. So call 243-3937 to book your screening today. The Maria Holder Diabetes Centre also recently received a donation of a spanking brand new state-of-the-art OCT machine to use in eye screenings. I asked Dr. Charles Pierce, clinical lead of the Barbados Diabetic Eye Screening Program, to tell us more about this new OCT machine.
So we now have an OCT machine, which stands for Optical Coherence Tomography. And essentially what it does, it creates a 3D image of the retina, which is the back of the eye, and it allows us to see any advanced changes that are happening as a result of diabetic eye disease.
So how is this better than the previous eye screening equipment which you had?
The previous equipment is a retinal camera. It allows us to see if there is any early signs of disease affecting the back of the eye. The new equipment we have is quite similar to an ultrasound machine in that we're able to get more details about what is happening in the retina. So diabetes affects all the blood vessels in the body, and specifically in the eye, it can cause leakage from the very small blood vessels in the eye. And this leakage collects in the center of the eye, the macula, which is responsible for fine detail and can cause significant reduction in your vision. What the OCT machine does is it allows us to see how much fluid is leaking from these blood vessels, and then we can decide whether we need to treat or whether we need to monitor more closely.
Thank you, Dr. Charles Pierce. And you listening to VOB, remember you don't need a doctor's referral to get your eyes screened for diabetic retinopathy. Just call 243-3937 and make that appointment. Coming up next, we promised you earlier in the show that we were going to talk about ham. But before we talk about it, we are going to sing about it. So for the song of the day, we go to this popular Christmas ham selection by an artist called Preacher, who like ham so bad, he sing about it. So let's take a listen to Brownie Ham and then listen to what dietitian Victoria Cox got to say about it. Compliments, the Maria Holder Diabetes Centre.
Bring all the ham, it's time to yam. Christmas time is here, everybody have to share. Bring all the ham.
Let's talk ham.
Greetings I send to you, yeah, what I want you to do. Bring all the ham. Bring all the ham, it's time to yam. Bring all the ham, it's time to yam, it's time to yam, it's time to yam.
Contact the Barbados Diabetic Eye Screening Program today at 243-EYES, 243-3937 to find out how you get your simple digital eye screening done. The Barbados Diabetic Eye Screening Program.
Bring all the ham. It's time to yum. Bring on the ham, bring on the ham. It's time to yum, it's time to yum.
Let's talk ham.
Oh, the doggy beef a pork, I made all of them up. Bring on the ham, bring on the ham. It's time to yum.
It's time to yam. If you're a diabetic and you like eating ham, you might be wondering, it's Christmas and I can eat as much ham as I want, right? Cause ham ain't sugar. Well, let's hear what dietitian with the Maria Holder Diabetes Centre Victoria Cox has to say about that.
So let's talk ham. Indeed, some might play devil's advocate and say that since I always focus on whether something is a carbohydrate or not as to why it should be, avoided or minimized for people with diabetes, that ham must be fine, right? Because ham is not a carbohydrate. It is not a starch. It is not a sugar. It is a mix of protein and fat. And so one could say, okay, cool. Well, if I have diabetes, I can go ahead and eat as much ham as I would like. And sure, I wouldn't expect ham to spike blood sugars, although the way that some people prepare ham, there might be sort of a sugary coating on the outside. You never know. But technically, ham is not a carbohydrate, so it is not going to directly sort of spike up blood sugar levels in the way that starches and sugars would. However, that does not mean that ham is qualified as something that is healthy. There are plenty of foods out there that are not carbohydrates, so they're not going to spike blood sugars, but it certainly doesn't mean that they're nutritious or healthy. So for ham, it's a processed meat. It's going to be high in sodium and other preservatives. It's going to be high in saturated fat, and so it is still something best to be enjoyed only in moderation. So correct, it will not go spike in blood sugar levels if you're living with diabetes, but we don't want that to be the reason that we overdo it, because it's still not exactly the healthiest food. And so, it's, like I said, best enjoyed only in moderation as part of a meal that hopefully otherwise has, healthy options like vegetables and salads. We want to remember that these things don't just disappear over the Christmas season, and we still want our meals to be nicely balanced and, overall high quality.
So you heard dietitian Miss Cox, right? If you're going to be yamming ham this Christmas, yam it in moderation. That's the message from the Maria Holder Diabetes Centre. This show will be done in soon, but before I go, I want to remind you about a new vascular screening service which is being offered at the Diabetes Centre. If your legs paining you or you feel like you got bad circulation, you might need to call 243-3937 to book this service. Let's hear what patient Donald Clark has to say about who should receive a vascular screening.
Once you have reached 50, you need to go and get that check done. It's peripheral artery disease. It's a simple test. It's called an API test, and what they're looking for is to see the blood flow in your lower extremities. And I can't stress enough the importance of getting this test done. I'm glad to know that the Maria Holder Foundation is offering this. Individuals need to go and get that test done. It's a simple test. It's all external. Again, it's like taking your blood pressure on your lower extremities.
The Maria Holder Diabetes Centre, located in Warren St. Michael, with their diabetic eye screening program, offers a standard of service that equals or surpasses any you might receive internationally. So if you're a diabetic or pre-diabetic and listening to your radio right now, you need to make an appointment and get your eyes screened by calling 243-3937 to make that appointment. In addition, there's now a new vascular service that is the centerpiece of a national campaign that will highlight the discovery of early circulatory problems in the limbs and extremities of at-risk persons. So if you are having vascular or circulation problems, call and make an appointment at 417-0305 or 243-3937. The last 15 minutes you heard on your radio was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Centre. Until next time, take care of your eyes.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives. lives.
Tune in next week when you'll hear
I like black cake real bad. Can diabetics eat black cake?
the answer next week on the Maria Holder Diabetes Radio Show.